Let's now bring into the conversation our foreign news editor, Sophie Mokoena. Sophie, you've been given quite a comprehensive look of the outbreak on the continent. We'll talk about that. But first, let's talk about the breaking news. 2 deaths reported now in the country.
Yes, when you look at the numbers now in the SADC region, you have 3 people who have died. One was in Zimbabwe. We saw the reports during the week. And now you have 2 people who have died in South Africa, both in the Western Cape, one in a private hospital and one in a public hospital. I mean, it was expected. When you look at the numbers are quite high in South Africa. In fact, South Africa is the epicenter of the pandemic here in the SADC region, but generally on the continent and in the sub-Saharan African countries. And you saw yesterday President Cyril Ramaphosa engaging with other African heads of state, talking about this matter. Among those leaders who joined him on the video conference was the deputy chair of the AU, president of DRC, Tshisekedi, where you also have a problem of this virus. Then it was the president of Mali, President Keita. You also had President Kenyatta. We know now that there's a death in Kenya also, and this person came from South Africa via Swaziland and then went to Kenya. You also had the outgoing chair or the former chair of the AU, President Al-Sisi of Egypt. You know that Egypt is sitting at number 2. We are number 1 in terms of the challenges. Let's take a listen at what the president had to say after the meeting, because they had an agreement to deal with this matter comprehensively, looking at putting up structures in different regions, but also setting up a fund. Let's take a listen at what the president had to say.
All right,
We also agreed that we need to set up regional control centers, task forces rather, so that SADC has its own task force, ECOWAS also has its own, Eastern Africa has its own, Northern Africa and Central Africa. So all the 5 regions of the continent should have their own task forces that will work together, and that our ministers of health should be in those task forces and work together. We also agreed that we needed to call on the world, particularly your more developed economies, to come to Africa's assistance from an economic point of view, so that they provide stimulus, so that we are able to have the resources to support our economies, but also to allow the manufactured goods that we need from various countries, such as medical supplies, to be imported into Africa. They should not close Africa off. Lastly, and more importantly, we decided to raise a fund, the Africa Coronavirus Fund, Solidarity Fund, if you like, which will help the CDC, the Controlled Disease Center, but which would also help countries that are going to be in greatest need. We were able immediately to raise $17 million amongst the various countries.
So what the president is saying speaks a lot to the funding of this fight. And where do we expect, in terms of AU members, which countries do we expect will come forward and heed that call?
Well, as the president has indicated, right now the fund stands at $17 million. These are the only 5 leaders who came together and they were able to raise this amount. And therefore now the message will spread to other 54 or 55 African countries if you use the AU numbers in terms of recognized countries on the continent, but 54 with UN structure in terms of the African structure, based on the fact that they are still working at recognizing Sahrawi. But the president is now tasked with responsibility of engaging all other leaders. You know that he's currently the chair of the AU, and therefore he has to engage others to ensure that they are able to put together this money. But secondly, I think President Ramaphosa, with his relationship with many businesses around the world, not only in South Africa, will be able also to make some calls to ensure that business on the continent, particularly the multinational companies who are working on the continent, they're able to donate. You know that during the Ebola crisis in DRC, Sierra Leone, there was an effort by African business, you know, Ali Dangote, Patrice Motsepe, they established what was called the Ebola Fund. And I think they are using the same structure now. It's called Corona Fund. And I think people like Ali Dangote, who had already indicated that he's willing to help, will come and help. And then also people like Patrice will be on board. And we know that Alibaba, Jack Ma, the foundation,
has already sent
portion. I mean, yesterday we saw the delivery of consignment in Lesotho, the mask, the sanitizers, and also the protective gear. And the same with Zimbabwe. They have received their own consignment. South Africa is also receiving its consignment, because this consignment is going to be distributed to all the 55 African countries. And we know that very soon, people like Bill Gates might come on board.
There's a big need for a global conversation with this outbreak, Sophie, and the president extended his conversation beyond the continent and went to the G20 countries as well. Break down that call for us.
Yes, yesterday, through video link again, the president joined the G20 member countries. You know, South Africa is the only African country, a member of the G20, but he was joined by President of Rwanda, Paul Kagame, who is currently the chair of the NEPAD. You know, NEPAD is an institution that deals with development on the continent, and they made an appeal to G20 members, particularly those industrialized nations, particularly the G7, to assist the continent. Let's take a listen, but not only them, but also IMF and World Bank. Let's take a listen again to President Ramaphosa, the chair of the African Union, presenting an African case, not a South African case.
We as Africa have called upon the countries of the G20, particularly your more developed economies, to support stimulus packages for Africa, to have debt relief from the World Bank, IMF, so that countries are then able to halt their interest payments, so that they are able to focus on fighting the coronavirus.
All right, so as we wrap up, when can we expect to see detail coming up in terms of these efforts and how they hope to be implemented?
Clearly, it's very difficult to convene meetings, and I guess we'll continue to get media statements from different countries making a commitment. And we expect the World Bank and the IMF to continue to give us an update in terms of how they are going to assist these vulnerable countries. We know that the CDC Center in Addis, it is continuing to collect information, but also making its own interventions, and we will continue to get information. But this is a crisis. It's a global crisis. You look at countries such as the United States of America, you look at what's happening in Germany, you look at what's happening in Italy. Even though China seems to be getting it right now, but there are now new reported cases, people coming from outside China. You have countries such as South Korea on lockdown and many others. You look at the United Kingdom, it is a crisis. Thousands and thousands of people have died around the world. And you can imagine coming to sub-Saharan countries on the continent, it is going to be a serious challenge, particularly when you look at diseases and challenges that we have in this region. And South Africa being an epicenter, because it's a point of transit. Everyone who's traveling on the continent, they do take a turn in South Africa, but also lots and lots of tourists visiting South Africa. And I think the issue of OR Tambo should have been addressed long time ago.
Sophie Mokoena is the SABC foreign editor, giving us a continental and a global outlook. Here at home, the Department of Health announcing that 2 deaths have occurred as a result of COVID-19.